The Been There Done That podcast is brought to you by Excel Strength and Performance. Excel S&P offers online individualized programming for athletes of all levels. They've just recently come out with a new website and it's really good. So let's go check it out. The link in the description below. All right, everybody. A new month for the podcast. So that means we got a new monthly book recommendation. This one, we've got Game Changer, The Art of Sports Science, written to you by Dr. Fergus Conley and Phil White. Now, Fergus brings a really unique perspective to elite performance, and this book details that in a very, very powerful way. Now, Fergus has worked with teams in the NFL, NBA, Premier League, and the NCAA football, and also many more. So he has a diverse background that's applicable to all sports. This book is very insightful and well written. I highly recommend it. Now go in that link in the description box below for the Amazon link to purchase your copy. Hey everybody, and welcome to episode 7 of the Been There Done That podcast. This week I was joined by netballer and Souwest Jets superstar player, Eastaugh. Ella is currently returning from a long-term hip injury, so he spoke about the injury itself, her rehab process, and setting long-term expectations for team success. Thank you, Ella, for joining me on the podcast. I hope you all enjoy it. I'd like to come and get in early just to get a start on the day, and then they just have to come in for the review. Oh, perfect. At the end of the day. Oh, and that's his only.
Netball's nothing like that. We don't get netball. I play at the same level as footy, and you.
There's you don't get any of that.
We get an S&C program at the start of the year that everyone does. It's not individualised, and then footy. You look at footy and you just go, wow. Footy and netball are like
worlds apart. So let's go on. What's your type of training week? Like your scheduling in season?
So we train at the moment. We train on a Monday night and then a Wednesday morning. Wednesday mornings are a bit of a drag.
Wednesday morning.
Yeah, 4:30. I'm up. Alarm goes off 4:30. Wake up. We train in Darling Range, so it means that I have to travel 45 minutes to get to the bottom of the hills. And then we play on a Friday. So we expected also to do a gym or running session in between, but it just kind of depends on what you want to do and whatever. So
there's no like set gym program you have to do. It's like a team. It's just your individual sort of stuff.
Yeah, and like I would prefer to go and do a proper gym program by myself as well and do a running program, because 2 trainings for me doesn't seem enough, and to be able to run in a mid-court as a centre for a whole game, you just need the stamina and you need endurance to be able to just go forever.
Yeah, well, that's what Joppy said that when he was on the podcast. He said the training that you kind of do at club level is just is like the bare minimum. Like you need to be able to go up and top up extra, all that sort of stuff.
Oh, you have to, otherwise, especially you can't. There's no shortcuts in, and you can see who's fit and who isn't fit. But I mean, these days netball's changed this year for state league, which is same as waffle kind of level. We have just changed to be doing rolling subs, so it's similar to a basketball setting where you can come on and off. You have a certain box you have to stand in. At the moment, because of COVID, we can't do high fives, but the coach can say, just give you a little wink or call your name, you come off, somebody comes off for you, you could come off for 2 minutes because you've thrown 3 balls away and you just need a second to recompose, come back out and then start again.
Do you find that has that changed the game at all? Like, has it made it faster?
Definitely. It makes it just more exciting in the game. You don't deal with any lulls in the game. Obviously, in any kind of game, you're going to deal with momentum shifts, and you're going to be up, then you're going to be down. And sometimes all you need is that one person. They need to come on for an impact, or they just need to come on and take an intercept. It kind of changes the game, definitely keeps it fast, keeps it fresh legs coming on all the time, which is hard if you've been on for the whole quarter and somebody new's coming on you. So then that's a whole different aspect of fitness, like the training component as well. Like it's more intermittent in nature, not so much a longer period, because before it was you would have a change would be in breaks, your own time be able to sub, right? Yep, or you could netball change, so you used to be able to call time and you could make a change, but now they've changed it. Time is injury timeout. So if I call time, you have to come off, which sucks. But sometimes you just need you need to make a change. Otherwise, the game just is not gonna. The game just goes on, or you might be down by 10 goals and you just need somebody else. But then there's so much strategy that comes into calling injury timeouts. Now sometimes it's just to get a stop.
Yeah.
It gets a bit.
Well, that's the same with soccer. Soccer do the same thing too. Towards the end of the game, they'll kind of just fall down, and then they'll kind of waste a couple of minutes just to freshen up a little bit.
Oh, definitely. And even the physios, you just have to be ready. You might need to call time because the coach just needs a change, and you have to call it. You go. Umpire always asks, why are you coming off? And you just have to make something up. Or asthma, I've got a sore ankle, and then you have to go over and see the physio and them just to touch you a little bit and then touch your ankle, whatever,
just to play
and then
around
just
and
put you back on, just so that
give
it
them
looks like a...
something just to make sure they're doing the right thing, I guess.
Yeah, exactly.
So you've moved clubs recently, is that right?
Yes,
year?
I was with Eastaugh Sharks, and then because of my injury that I've had this past 9 months, I ended up changing clubs. So I'm now based with Souwest Jets, and they are a southwest, so Bunbury, Bustleton, all that area club. But because nobody over the age of 20 still plays competitively or at a high level down there, they've made it a Perth-based team, which means that they can just still keep the competition alive down there and still promote the area. So we've got 5 games down there this year.
Oh, nice.
So they'll be on a Saturday, I think. So same kind of competition, but we just go travel down there, kind of promote the area and all the programs down there. And we have probably 6 girls that have lived down there, but now they live up in Perth because of uni, which still means that the club is still showcasing their own talent, and it's a bit hard to promote culture because the 20s, we've got 2 leagues. We've got under 20s and then opens. It's a bit hard to be a club at the moment, so we've got a camp down there next weekend just to try and bring us together, because at the moment it's kind of 2 clubs in one.
So you were saying how everyone over the age 21 kind of goes away. Is that because they all go to uni and have different stuff up in Perth?
And some people, I think some of the girls get a bit bored down there because there's not a lot down there. Their parents love it because they've been down there the whole time, but all their friends, especially if you play netball, you usually have a lot of Perth-based friends, so they come up here, uni, TAFE, that
just
kind of
life
thing.
brings them up here.
Yep, definitely. And then they go, oh, maybe in 10 years I'll go back down, but they want to see the Perth kind of life.
Is it a zonal system? So like, because it's now a Perth-based team, and then all the talent, is that when they recruit from Perth, is it from that area, or when they come up to Perth, they just go wherever they can play wherever they want?
These days you can kind of play wherever you want. It used to be, so when I played at Eastaugh Sharks, they were called Coastal Sharks 2 years ago, but then
now
the naming rights and we've attached to the footy club, they attached to the footy club. It used to be like Coastal Sharks was Peel, Rockingham and Fremantle. All the other teams had certain zones, and now it's kind of, if someone contracts you, then you're
free for all, kind of a little bit like a soccer type of thing.
Yeah,
From
definitely.
the juniors. And now you're trying to build that base of the juniors all the way through.
And try and bleed the youth and, showcase the talent, especially in places like this, like Southwest. The girls, sometimes it just seems that some of them don't get the opportunity to be able to play, and, they're kind of down there, especially when you're 20, you only have that team, so they're always quite young. Their open team until now is always quite young. I mean, the team that we've got now is still really young, but they were playing open when they were 15 because they just didn't have a lot of, and they're playing against 20 to 30 year olds, and just the experience versus whatever that they would get flogged every week. But hopefully this year we can
have you found that now, like the rise of a lot of other female sports like footy, NRL and that sort of stuff, is it kind of taking away from women from like the traditional women's sports like netball and all that sort of stuff? You haven't really seen a decline in people?
Yes and no. Like, I think some girls, if they don't feel that they can go far in netball, they choose another code of sport. So take it for example, Emma O'Driscoll, she's a down south girl. She I think she's down south. She was playing netball for Souwest Jets and then moved clubs a little bit, and then just decided she wanted to give footy a go, and then now look where she's with Free Dockers now and absolutely thriving. So some girls, I think, if they realise that they're not they might not be enjoying netball as much, and don't see themselves up here and playing for our like West Coast Fever, then they just give it a go. And I think footy and netball are pretty similar, but at the same time, there's still huge differences in the codes of sport, but they've still got hand-eye coordination, so just being able to learn to kick a ball just seems really easy for them.
Yeah, I guess, you are right. It is right. That would be but probably the biggest thing to handle would be just the size of the field you play on.
Definitely, and just having the step, netball's quite a stop-start. Like, all of our strength conditioning is 30 seconds on, 30 seconds off, or running 30 metres as fast as you can, walk back recovery, do it 20 times and then have a break, that kind of thing. The running is way, way different to, obviously, me watching footy, and you go run for a minute as hard as you can, as far as you can around the oval, and then...
it's a lot more endurance-based.
Definitely. Netball, I mean, I hate S&C conditioning for netball, though. It's brutal. It's, you end up having to do 5 sets of different things because you've just got to get the fitness in, and it's, it's quite draining on the legs. You just feel like you can't change direction anymore. And on a 30, and most of our conditioning is done on the 30-metre court, so there's lots of changing direction and things like that. But
well, that's the sport. That's the sport. You have to change direction.
Yeah, definitely.
You have to be, and you have to stop on a dime as well.
Oh, that's a lot of our running when we do, if we're running 30 metres, it's a deceleration and come to like a stop in that squat position to be able to, just take care of your knees. And
so do you outsource your own S&C conditioning program? Do you
try to. Yeah, especially now having this, having had an injury, I am doing a lot more stuff with the physio and things like that. So they're giving me a lot more things to, especially specifically to do in the gym to be able to be strong when I come back, and also just to rehab an injury is really important. And I've always tried to seek out extra things because I can go and run and do my own program, but am I going to get better? Am I going to see that progressive overload going like getting better each week? It's hard.
And you study sports science as well.
I'm doing physio.
Physio.
We do a bit of S&C stuff in there. So
is there any of that you take in?
The gym stuff, definitely. Yeah. We've just finished the first 2 years of our degree was basically in the gym, lifting weights and things like learning how to lift weights and teach people. So there's definitely a lot of that stuff and rehabbing certain injuries. So, you take bits and pieces and, you take bits with a grain of salt as well, because all the stuff you learn isn't all necessary and applicable to netball.
No, that's true. But there's I think the biggest thing about uni kind of gets a bad rap with a lot of like sports science stuff because it's very hard to apply what you learn to the actual field if you're not doing like the prac side and then the theory side together. But the biggest part of it is like it creates thinkers. Definitely. And it's about it's like being critical thinking and be able to analyze, well, this is the theory and this is what's actually happening in practice, and be able to kind of pick the needle amongst the haystack. And because all this theory is not really going to apply in a practical setting, but being able to take the idea of that and then be able to apply that into the setting is what's going to kind of make it work.
Oh, that makes sense. That's exactly what I do. I go, we've been given certain programs to rehab someone, you go, someone's not going to be able to do that, or they aren't. You just have to be able to adapt. And I think Notre Dame do a really good job with that. Like, I love uni and things like that, but it's really hard to try and still, even now, just not having enough experience. I still find it really hard to go, change things and be able to adapt it to certain people is a little bit tricky still. But
so with your physio, are you out on practical at the moment? Yes.
Yeah. Well, we just finished. I did a prac in January with an aged care facility, so that was interesting. And then COVID shut that down again for the 5 days, so we ended up cutting that short. But it's been good to be able to put stuff into practice, but at the same time, I'm doing prac at the moment at East Freo, just getting extra knowledge in that musculoskeletal because I did the aged care, but I didn't feel like I used all my skills that we've learned.
You miss out, on a certain kind of demographic just with old.
Definitely, but we'll get to see all kind of physio modes in the end. But next year will be the big year with just prac after prac after prac, which is exciting. But even through this injury, doing footy, you get to see a range of injuries and how they rehab them, what they're doing. So it's pretty interesting to be able to come to footy each week, as bad as it is. Boys are getting injured all the time or just have little niggles, and it's Jordan goes, come in and have a watch and listen, and you just go, that's how you treat something like that. Or especially in a sporting setting where you go, old people, you give them 10 sit to stands and that's about it, whereas the footy boys, it's like go and run.
It's a bit more, you have to kind of push them along a bit more, because the funny thing is that most people forget, like, these guys are like, I don't know, like performance, like if you want to take away like the human aspect of these guys, like machines, like
they are
essentially, they're just workhorses and they need to keep doing work. As soon as they stop, they just kind of break down. Like,
and you lose fitness so quickly, I've found.
Oh yeah, your body wants to, like, you maintain homeostasis. If you don't do something, your body just adapts to not doing anything.
Yeah,
and that's if they're doing a lot of things all the time and then making them not do a lot, they're just kind of and then the body just is like, okay, we're not using this anymore, let's shut it down.
Oh, and it's, I mean, trying to adapt. I've found since having this period off of sport, it's getting back into the sport-based kind of stuff. So doing your running around footy is so different to being able to run. Like, you could tell someone to go and run for 1 minute flat out, but then when you do 4 1 minute kind of sporting-based kind of drills, I find, especially in netball, it's just such a big difference to be able to adapt to, yes, running, just straight running, but then having to focus on reading the play, adapting your style. Shorter, sharper running is so much different.
Yeah,
so there's that kind of...
Yeah, that's the hardest thing amongst, like, that's the blend between the, like, strength conditioning and then the field coaches, is that making it one connected. Like, you want to make it a conditioning kind of set, but let's do it amongst skill-based football drills, so then it kind of blends in blends into like you get a fitness component, and then you get your skills, and it's like fitness and conditioning.
Yeah.
And skills all on the one kind of drill.
I'm sure most people hate ball conditioning. At netball, everyone hates ball conditioning. You can do conditioning and then someone brings in a ball and you go, let's either do conditioning or let's do ball work. Because it's just, there's a huge difference between the two. But it's, I can't wait to get back into that. So hopefully next week.
So you're back.
Yeah.
So tell us about your injury. What happened?
So so last year we were getting ready to go away for Netball Nationals in Tasmania.
Yep.
So the state kind of program starts in September, October. You train. We start. Netball's a bit different in footy, as in there's trials to get into the program that they call Fever in Time. So they're trying to create athletes for that top level.
Yeah,
so you train for that for 3 or 4 months. Then they shortlist that, do another trial, have about 15 people for the state team, then cut that down again in about probably around end of December, January. So then you have 4 months to train as a team. You go away in April, and we got told at start of March that it was when things were getting a bit serious, and we were all kind of like, are we going away? Are we not? And all the coaches were kind of just dismissing, going, it'll be fine. It'll probably blow over, and we're all like, are you sure? And then one training we got there, and we're all happy as Larry, getting ready to train, get ready to move around, start training, and all the coaches weren't near us, and we were all like, what's going on? Like there was a psychologist there was all the important Netball WA people there, a couple of the Fever coaches, and then they sat us all down and told us that we weren't going away. So that was pretty emotional, because you train for 7 months and then aren't able to put that out on court. So they basically sent us away, and lockdown happened not that long after, and we got given a S&C program that was not specific to anyone, but just an S&C program to go and do, trying to keep fit in between state and then state league, which is WANL, waffle. Get us fit in that time. And I started running. You're going to hate me saying this. I started running, and I started getting this hip pain, and I've gone, mate, I must not be warming up properly, because I never get hip pain. I never get leg pain. And you go, oh no, I'll leave it. So did my running session, you kind of ignore it. You're running, everything else is hurting. So you go, the pain that you're actually feeling is not there. And then it would have been 2 or 3 weeks, and I've gone, this just isn't getting better. And my warm-up was getting longer and longer and longer every time, because you go, I just need to, all the glute activation, all the stuff you need to be doing. And I was like, still not getting better. And I remember going for a run with my mum. We went for about 6Ks, and we were halfway through, and I was like,
only halfway through 6Ks?
We were like 3K. We did kind of like a loop around.
Oh, shit.
And my mum can run for days, so running with her is okay, but she can just run and run and run, whereas I'm like 6Ks is about my limit if I haven't run long.
That's about 5.5 Ks too many for me.
Me too, but apparently I have to be able to run 6Ks these days. So I was running with mum, and I've got this like really bad like hip pain at the front, and gone like, we're going to need to turn around. And thank God she goes, yeah, we're turning around now. We're going to on our way back, and the 3Ks back was agony, and the best thing mum told me, just stick a spiky ball in it, it'll be fine. And you go, okay. So I did that for a week, and still not getting better. Went to the physio.
So how long has that been now?
That was probably 4 weeks.
4 weeks from when you first kind of had that.
Yep, and then I went to the physio, and it was actually really funny, because we started learning about all the tests you do for this condition that I ended up having called FAI, and none of those tests, obviously you do it with your student friends, and none of those tests were positive in me, so you go, great. And so then she started doing them on me, and I just turned around and looked at her, I was like, I've done these tests and I was negative, and she goes, you are more beyond positive than I should have been. So really? All like, they do lots of hip movements, putting them in overpressure, so they push quite hard to try and bring on the pain. And I was just in agony. And she's gone, this is what I think it is. It could be FAI, which is where you've got 2 bones that kind of hit each other continually.
So FAI stands for?
Femoroacetabular impingement. Yeah. So, everyone can have a degree of it, but it just depends if you do activities that aggravate it.
Like running.
In my case. And then she said it could be FAI, or it could be FAI and a labral tear, which is which the labrum in the hip lines the hip socket. So she goes, it probably won't be that. Let's just rehab it for FAI. So all that is just glute strength, hip flexor strength, kind of just global strength in lower limb. So I did that.
Did you pull back running? Yeah.
Well, that's what made it sore. So the physio goes, let's stop that. So 4 weeks stopped running. And
that's all during COVID as well. So it was
during COVID. So I
can't really go to the gym and
I did a 1-on-1 Pilates class with my physio. Physio Pilates is called clinical supervised exercise, because it gets rebated by the health insurance. So you do Pilates, rehab. I was doing 1-on-1 rehab with my physio, and we just did kind of everything while you're doing, like, your legs get tired, you do arms as well, just to
Okay.
get globally fit
Yeah,
as well.
yeah, yeah.
And I was quite lucky. My mum owns a gym, so she was able to bring home some weights and things that I could do at
lovely.
home as well. Just so she said, while you're not here for the 2 days, do this kind of stuff. Gave me, you know, the list of exercises that a physio usually gives you. And then I went back and she goes, let's just reassess after 4 weeks. I went back, you know, in the 4 weeks, and we did another assessment, and it was worse. And she was like,
Really?
Yeah, it just, the pain hadn't subsided, and I could find, like, running, you know, you bring your knee up to about 90. I couldn't hold that there without being in pain. And she was like, let's get a scan. And she said, before we started this 4-week block, it could be this and we might need a scan, but I don't want to scan you and to find out that I could have rehabbed something and you waste $400 on a scan, MRI.
And then something comes up, something could show in the scan that's, you know, actually...
That's a muscular injury that she could have fixed.
Exactly.
And then I went, I ended up going, she sent me off for a referral to the sports doctor. Oh, I had an MRI in that time. Then she goes, go see... sports doctor. She told me to go see someone else, but my dad, being at Freo, he got me into Ken Withers, who's their sports doctor. Like, the next day I rang him and I was like, I've got my MRI, need to see sports doctor. And he was like, go see Ken. Went and saw him, and he did the same test that Claire did, and I just grimacing. I just knew. He goes, I need to do these tests, and I'm like, you don't need to do them because it hurts. But he needed to see it, obviously.
Yeah.
And then sent me off to the surgeon pretty quickly. Went and saw the surgeon.
Wow.
And, with the scan, and he was like, yep, labral tear, which is the worst case scenario. And I had really bad FAI in my right hip, which is my problematic one, and then I have a little bit in the left, but nothing. I've had no injuries with that.
So that, was there an incidence where it just...
No, that's the funny thing. Most people ask, oh, how did you do it? And you go, I think over time, with this kind of injury, I think netball probably made the two bony bumps a bit worse, because if you're hitting them together, they're just going to keep growing. You break them down a little. You break them down a bit, they grow, bones grow back, and they obviously got so bad, and the cartilage was getting pinched and pinched and pinched, and the hole was just getting bigger and bigger and bigger, and inflammation, all that kind of stuff happens, and it just boom. You know, you've got lots of pain and won't go away. Running just kind of exacerbates that. More inflamed. So I went and saw him, and he was like, "Yep, labral tear," and I'm just like, what do I do? And I've heard of no one that's had this, you know, like
really?
hip labral tear. Heard of no one, and you go, oh, this is a bit weird. Like, what do I do for this? And what's the, you know, physio said that there could be surgery, there couldn't be surgery, there could be just cortisone injections. We'll just see what happens. And went and saw him, and he was like, it's actually really common. And I just looked.
Yeah, you hear a lot about amongst like a lot of lifters, like Olympic lifters, and anyone who's like in that deep squatting and does like real heavy weights, and even some of them like even the powerlifters as well. They do this this type of squat where they just it's called a box squat, but they do it. They almost try to stay vertical, torso position, just sit on the box, and there's a lot of that pinchy sort of. You see as soon as you get to see the position, they squatting down, but
and you just watch the face.
Yeah, you see the face, and you see their like how pinched they get in their hip, or how. Yeah, just you see like the angle at the hip joint
that
is so close that that's what happens.
And you hear a lot of, I now know quite a few people that have had this injury, and quite a few, Dad was saying that he knew quite a few people when he was around, and now I know a lot more footy players that have the FAI problem. So it's just about strength conditioning and trying to get it strong enough so that your muscles can kind of pull those two bones away, if that makes sense.
Yeah.
But I went and saw the surgeon, and he was like...
And how long was that? So from the first time you had it to now, like seeing the surgeon and...
That probably would have been 8 weeks, 8 or 9 weeks. So it took, because I didn't put my scan through a, you know, WACE or, you know, anything like that, it took like 5 days to get the report back, and by the time you go and see, so it took it was probably about 9 weeks. I went and saw the surgeon, and he was like, look, I don't want to operate because it's still too premature. And I was kind of there like, I've tried everything, I've tried everything without any invasive measures to fix it. And he was like, you're young, let's try cortisone injection. And physio said be prepared for it. And it was actually funny listening, because my lower limb physio lecturer, he was like, any jabs around the hip, a no-go. And I was sitting there just...
Really, was that?
Just because your hip, there's so many bursts, there's so much fluid around the hip that it's actually... It's a bit intricate and a bit hard to get it in the right spot, and especially you have to go under ultrasound or CT to try and get it in, and being really specific is really hard. So I remember emailing him and going, so my surgeon wants to give me a cortisone injection, what do you think? And he was like, what did he say it was going to do? And I was like, he said it's more used as a diagnostic measure, if anything. So he goes, it probably won't work. And you go, great. So I'm going to
wasting more
waste
time.
6 weeks. So I had to wait
Oh.
because cortisone only lasts about 4 to 6 weeks.
Yeah.
I had the cortisone, went to the radiology place, stick it in. I was under CT, so they have the needle like that big thing in my leg the whole time, which is, it was...
How do you go with needles?
I'm fine. Like,
I can't do it.
I honestly,
That's bad.
lie there, you're chatting, you don't even know that's in there. They give you a local as well because it's going...
Yeah,
they
but still, nah.
They have to go right into the socket.
Did you look at it?
Yeah.
Oh.
And even like the scan, I love looking at scans and things like that. Even like I was watching, they show you the scans up on the TV up there, and because they need to look and make sure that's lined up in the right spot. Then they're putting the cortisone in there, and at that time I had local, so I couldn't feel my thigh, just the top of my thigh, like surface level, and had that. And he said, come back in 6 weeks. So I booked an appointment 6 weeks, and I had like no relief from it.
Really? For the whole 6 weeks?
I think I said to Mum, I said the most relief that I had was that 4 hours with the local.
Oh wow.
Local, and then after that, you just wake up. Okay, maybe this is the day that it'll kick in and it'll work. So cortisone's an anti-inflammatory. Yep. Really localized. You don't need to take a million anti-inflammatory tablets. And it just wasn't getting better. So we rang back 4 weeks and we went and got an appointment. He goes, "You're back a bit early," and we were like, "Yeah, because nothing's worked." And then he goes, "Well, we know what the next step is." So I had, then he goes, booking in a surgery date. I was like, wow, that this is actually happening. And he said that with this kind of injury, it's a 9 to 12 month rehab process because cartilage isn't a favourable healing tissue.
No.
So I ended up, surgery was booked months and months in advance, months and months later because of COVID and the backlog of patients that he had because elective surgeries got cold. And then we waited, and then the receptionist ended up ringing back and going, "Actually, we can fit you in like a week and a half." And I was on the phone going, "Okay," like you just say yes because the sooner you get it, the sooner you start rehab, the sooner everything.
It was obviously very nerve-wracking.
A little bit, and then came back a week later. So I had surgery at the end of July, and I'm going in and just going, you know what, I can't. There's nothing to be worried about because at the end of the day, this should fix what I'm going to do. And learning physio stuff, if you're kind of fretting the surgery kind of pathway, you're worried it impedes surgery, it impedes healing and things like that. So you just going, it's going to hurt, it's going to be long. There's no, they're experts. There's no need to feel they don't know what they're doing, that kind of thing. So I went in and just had to be like, you know what, it is what it is, and nothing. I've done everything in my power, so there was no. I was trying not to get too down on myself, going, "Oh, I should have done this, I should have done that." There was no way that I could have fixed it. So the surgery, 3.5 hours, because they had went in through keyhole.
Yep.
So I have 3 little scars on my leg there, and
what's the process there? So they go in and they what?
Yeah, so I had to have a spinal anaesthetic first, so numb from belly button down. So that was 12 hours after that. Couldn't feel my legs, which is great because there was no pain, nothing.
For a while.
And lucky my surgery was at night because I just kind of slept it off. So I had that done. They go through keyhole ones. Got one of the probes has water. I actually watched the surgery before. I just
you watched it on like
I watched like a YouTube, some vlogger
so you knew what was
put up
happen.
something like a label. I was like, may as well watch it, and watched a few of her like rehab videos coming back like 6 weeks, whatever, and you knew what to expect. So I watched it, but he told me anyway. So one probe had saline flushing through, so I woke up and my leg was like that big, and then the other one had the scalpel and little probe camera, whatever, and they ended up sewing the whole of the labrum back onto the edge of the rim of the acetabulum, and then they ended up shaving off the 2 bumps of bone as well, just to try and stop that.
Will that ever
pitching.
Will that come back or?
Hopefully not. But I had to take, so after the operation, I had to take anti-inflammatories for 6 weeks because anti-inflammatories the way that they work are meant to stop inflammation, but having that after where there's been quite big trauma to the bone, it's meant to stop bone growing back. So I had to take that for 6 weeks after. So hopefully not, but you never know. It could grow back because of hitting again, but it shouldn't because of the the procedures and the measures you take beforehand to stop it. But yeah, it was a big process, and in surgery...
It sounds intense.
It was, and, you know, not knowing anyone that had gone through it was a bit harder because you couldn't... It's not like your friends who have had an ACL and you go, how was your surgery? Comparing kind of things, and I was just kind of like... All my friends were like, what does this mean? What are you doing? And whatever, so I was... I felt a little bit on the outer and a bit isolated in that way because you don't know and you can't really draw on anyone to go, how do you... And none of my friends have really had long-term injuries that required surgery to fix. So you go, there was no one really to talk to for it. But at the same time, I just had to go in with the information that I had from surgeons, physios, lecturers at uni, and they were like, you'll be fine. So had surgery, and then, the rehab process started from there.
So do they ever put a finger on why or how it degraded so quickly? Or was it just something that's an individual to...
A bit individualised, but I mean the FAI problem can be hereditary, so that could have come from mum or dad. Just
that's interesting.
Just
So that's because the
developmental.
way you're...
So it could have been a multitude of things, but I can't. Now that I think about it, you can't really pinpoint. And he was like, probably playing netball didn't help you out in any way. He goes, you could have not played netball and not ever had this problem. And I was like, great. So he goes, you could have had the 2 bits of bone that were there, but you know you haven't done anything to pinch anything and make anything sore. So
It's interesting because you never hear that common amongst other netballers.
No, definitely not. It's and even like most netballers, you know, do knees and things like ankles. I've done a few, not done ankles, but you roll your ankles or whatever, but nothing hippie kind of things. And I was talking to the oldies on prac, and they're like, hip surgery, and you go, it's not that kind of hip surgery that you were thinking of. I didn't have anything replaced. It was actually a sporting injury. But yeah, the rehab process has been pretty long. I think I'm 8 months, nearly 9 months down the track now, but it's been long and grueling. And
so how long were you... So you had the surgery. How long until you actually got to stand up?
6 weeks on crutches. So the first 4 weeks must have been... Yes, 6 weeks definitely on crutches. I could start like a minimal weight bearing. He said, imagine that you've got an egg under your foot and you're trying to just squash it. So you could put a little bit just because you need a little bit of weight bearing to get that structure to kind of get a bit of load through it to start that
healing
recovery process. And from there it was 6 weeks on crutches. I went to uni the week after because I felt that I was getting a bit of FOMO, missing out on too much. But I mean, I had really good support. Like a lot of my friends would drop me in at uni, and parents would drop me in as well. So, and most of my classes you sit down anyway. So
were you in a wheelchair?
No,
crutches. You're straight on crutches. Just walk on one leg on crutches.
There was no way that I was going to go in a wheelchair. Not
you pride, too much pride for that.
Not even. I was just like, I don't want to be given that much sympathy and pity for that kind of thing. So I was like, and he was like, crutches are actually really good. Like get you around, get you moving straight away. So
I guess it gets you out of that mindset. I want to sit down and.
It was actually funny. The first encounter that I had on crutches in hospital, physio came in. So physio usually comes day after just to check how you're going, give you some exercises in between the time that you're going to go see your surgeon, and took me up for a walk, and I was feeling fine. So I hadn't gotten up. So I got into surgery. Well, not into surgery. I went in at about 3 o'clock, and from 3 p.m. I was lying in a bed until 10, 11 the next day because you have surgery overnight. You're just in bed. They get you up once for the bathroom, but even then you're not really allowed to stand up because you have to sit on this weird thing that collapses just because of the anaesthetic and things like that. They don't want to get you up.
Oh, yeah.
Without physios, the nurses don't have that kind of manual handling training. And physio got me up, went for a walk just around my ward, got around, and she goes, all right, you did pretty well. Here's some exercise. I'll come back and see you in the afternoon. And then she walks out, comes back in, she goes, the nurse needs you to go to the bathroom. And because I've had a spinal, sometimes that can impede your
everything.
sense to go to the toilet. So she was like, can you just go? And I was like, I honestly don't need to go. I went just before we went for a walk. And she was like, just let's make everyone happy. Let's go. And I was like, okay, see you this afternoon. Shut the door. And I've started feeling really sick. And you just go, what is happening? So I sat down on my little toilet frame that was over the toilet because I wasn't allowed to sit with my knees at 90-90. I sit kind of on an angle like that.
Yeah, because of the hip,
hip impingement. So I was sitting on there and I've gone, you're just feeling really woozy, and they have that little nursing button, and I've gone, something wrong is going to happen, and I just feel it. So I've just pressed the button, and honestly, I pressed the button and I've just...
As soon as you pressed it?
Black. And I've woken up. No. I've woken up on the bathroom, like in the bathroom, like lying back with like 17 nurses in my room, and I've just woken up in the biggest days, and I've just started sweating and just fainted in the bathroom.
Was that just from?
It's called what's it called? It's just a drop in blood pressure which causes you to faint. So not enough blood was going to my head, and I've just in that case, you just pass
Is this
out.
because you moved around, or was
Yeah,
that
moved around. So that was the first time I
Too
moved
much
around
moving.
in 12 hours. And, you know,
Whoa.
just, you know, we're quite active people. You move around quite a bit. So lying down in bed is not a favourable factor, clearly, in my recovery. So I was lying down for too long and then got up and had a little faint, and then I felt really sick afterwards. And then they're like, should we call your mum? And I called my mum, and of course she's working, so didn't pick up the phone. So I've gone, I didn't die, so I'm going to be okay. And then mum rings me back like 2 hours later. Why did the nurse ring me? And I was like, I've just
Fainted on the
fainted.
toilet.
It's fine.
Fainted on the toilet. That's hilarious.
It was so funny. I woke up and then they've got oxygen on my face trying to get me back, and I was fine. And the physio comes back in the afternoon and is like, oh my God, I'm so sorry. And I was like, it's not your fault. Like, I couldn't tell until I sat down that I started feeling sick. And honestly, when she was doing my exercise with me, she was this close to my face and just eyes on my eyes. Are you feeling okay? And I'm like, yeah, I'm good. I'm good. And
That's
then,
hilarious.
yeah, so 6 weeks, saw the surgeon 2 weeks later, get stitches out. 6 weeks, came off the crutches. I actually ended up taking one to uni just to make sure that, just to tell people to get out of the way, because the streets of Freo are not really nice for people with any kind of disability. No. Crutches, wheelchair, nothing.
You wouldn't have been able to go around with in Freo on a wheelchair.
I actually had to do that for one of our units, and it was the hardest thing in the world. And some people are actually really just ignorant and whatever, and just not realising that people actually need help.
Yes, because everyone's so caught up in their own world.
Exactly. So, yeah, I just took one in, and then it's about 6 weeks that I could start really doing anything. I mean, in the meantime, I was just doing little isometric quads and glutes and things like that.
Did you try any of that? Did you get any of the complex, like the EMS, electrical muscle stimulation?
No. I don't think, I mean, it wasn't such a, and my physios were like, I think, especially playing sport, you know how to contract your quads and your glutes quite extensively, so just do that. And
we've had experience using it with ACL rehab. We do a lot of it with, for quads, we do it like at the start, obviously, because you can't get much knee extension. Just get the quads working, get the muscle bulk back, and then after a couple of weeks, you throw them back on the hammies once that's kind of areas healed up. And then you get there on the hammies. It's one of the weirdest experiences everyone always says, because it's like, because you're kind of lying down, or if you're doing the hammy one, they always say the hammy's the weirdest one, because everyone's kind of used to doing this kind of thing. But as soon as you lie on your stomach and your hammies are contracting, you're like, there's that kind of feeling.
Yeah, no, I didn't. I probably could have, but I just don't think at the time my physio just didn't probably really think about it. And I mean, at that time I was seeing my physio a little bit, but I was just kind of doing the exercises, because surgery, obviously surgeons are quite strict in their protocols, and my surgeon's quite conservative. I think just the program that I was given was enough, just constantly tensing and just making sure I was getting a little bit of range. So abduction, circumduction, that kind of stuff, just to keep the hip, otherwise it gets locked up. And then went saw him 6 weeks, and then he was like, ditch the crutches, you can start driving. I was like, thank goodness for that, because I hated.
You lose your like you lose kind of your freedom. To go out and just go and drive and go out and do stuff. You always have to rely on someone else, don't you?
Your friends are like, no, it's not a problem. And you go, I know that it's not a problem for you, but it's a problem for me, because I don't like having to, most of my friends will drive past, but you go, it's just still like, you shouldn't have to, but at the same time, they're like, it wouldn't ever be a problem. And you're like, yeah, but I hate having to rely on people to, and I hate being late to anything. And I love being like 15 minutes. Like even today when I was getting coffee, I was like, this guy needs to hurry up because I'm an idiot. But yeah, I just hate it, like just having that, having to rely on somebody else. And I'm quite an independent person, so being
because you want to have the option.
Lose just your pride for a little while and just have other people do stuff for you. And I hated not being able to make my own breakfast and not being, I had to stand on one leg to butter toast and whatever. If I was ever home alone, I was like, I can make my own breakfast and whatever. But it was quite difficult in that sense, just to allow other people to help you out and whatever. And I
think that's a lot of like a sports, like a high performance kind of brain. You don't really want to rely on anyone else.
No.
To do something for you. So always you want to be able to go out and show.
Definitely.
Yeah, like it's like the sport. Like you want to go out and perform.
And I hated going to netball and getting pity. Oh, how are you going? And you go, I'm fine. I'm good. I'm 6 weeks post-op. Like I'm where I need to be. I'm probably better than where I need to be. And that's all that, I don't need to say anything else.
Yeah. So after you had your surgery, did you bounce back quickly?
I found, yes, my physio was, obviously I was kind of you get a bit bored doing the same thing. I'm sure it's pretty similar for ACLs and things like that. You're doing the same thing for weeks and weeks and weeks until the surgeon gives you the all clear to start doing something else. Like I think 8 weeks, I could start riding a bike to get that range. So it was no resistance, just pedaling.
You'd have to have a sit, like a lower.
I just had to sit, and honestly, my toes were the only things that was on the pedals because you just had to. I had to make sure that my hip was
so you
90,
had to
90.
be you had to be higher.
Yep. So I couldn't beyond. It would have been beyond 9 weeks. I could start sitting in a normal chair, and at home I had this lovely wedge cushion that was foam, and I had to sit on that wherever I was, or sit on the edge. Like I would sit on the edge of the chair and make sure my hip just dropped down a bit to make sure that in class I was like, I'm not gonna bring like that cushion or anything to put that on. I was like, I just don't need to carry that around first of all and then sit on it. But yeah, so beyond that I could start doing little like mini squats, things like that. Kind of a little blur now. 12 weeks. I started actually going back to Pilates and doing really gentle, just once I could go 90, once I could kind of just stay in that position, not go any further, just started doing my rehab. That's when my physio kind of took control beyond 6 weeks. Just trying to go whatever's on the sheet here. I'm just going to progress from that. So it was very slow, and I just remember being in Pilates going, so can you challenge me yet? Can you make me give me something that's going to feel the burn? But it was just all about just getting range and movement kind of patterns back in again, because obviously I hadn't squat in a very long time, and getting change was the hardest thing, especially while you're on crutches. Just trying to get normal movements back in was the hardest thing. But from there it kind of just got better and better and better. From day dot, great anaesthetist, I had no pain. Like I stopped taking pain meds probably 6 days after the op because I just wasn't in. So they gave me not a strong pain med, but strong pain med in regards to taking paracetamol, ibuprofen. But they send you home with that. So I had a slow and fast release, and then also had Panadol Osteo, which is more directed at joints and things like that. So I just ended up taking that, because I was like, the pain meds just make you feel a bit yuck, and I'm sure if you get stomach, and then also you're just like, you get really dazed out, and I was trying to do uni at that stage, and one day I'd actually taken the slow release and the fast release together, and usually from there I was Mum would always bring them over, like if I'm sitting there, she goes, what, do you need pain meds? And I'm like, yep, slow release. I just kind of knew, and I had a little app on my phone that would just tell me to take them, because he said first 5 days you have to take them as they are, just because that's going to try and stop any pain. And he goes, the last thing you want to do is be in pain and wait for pain meds to kick in. So I took those, and I remember sitting there and I was watching a lecture at that stage, and I was like, what? I pride myself of never fallen asleep in a lecture. I'm always just trying to sit there and take notes, and I just remember falling asleep, and I'm like, what is going on? And then I was like, Mum, can you bring me over the packets? Because I'd never read them at this stage, because in the hospital they just give them to you. And I've read, and it's like increases effects of drowsiness, and then I've looked at them together and I've gone, great. So I've taken double, you're meant to take double, the dose, but then I've gone, then obviously you can't take with alcohol, can't take driving, otherwise you fall asleep on the roads and whatever. And I was just
so you'll fall asleep even if you weren't.
Yeah, I was just sitting there, and obviously if you're not doing anything to stimulate brain, you just start falling asleep. So I was like, okay, this lecture is done, because I'm just going to fall asleep. So ended up not watching that, but yeah, it's just, and then I actually, more needles, I had to have anticoag injections, so I had to every day at the same time. So I took them about lunchtime. You have to inject a little needle into your tummy to. What? I mean, you could take tablets, but the lady goes. She didn't really even give me the option, which was more annoying. She was like, "Oh, how do you go with needles?" And I was like, "I'm okay." And then so while you're in hospital, you just let them poke and prod around you, because you go, "This is what's happening." You've got an IV here, all these cords everywhere, and then she taught me how to do the little injections. So I had to do that every day to stop blood clots and things like that. But
how big was the needle?
Oh, it's
that's
tiny.
A small one.
Yeah, little one. You have to push all the
So they gave you all the vial and all the.
Yeah, you had to have a nice yellow container, and then you have to give that to the chemist, and they dispose of it properly.
So why do they go the needle over the tablets?
She didn't really give me the option. I think needles is obviously if you have anything that's straight into you, straight into the bloodstream, versus having to absorb the stuff. And I guess maybe they get. And I was being a active person, so I'm sure any athlete that goes in there, you're at a higher risk of getting blood clots because of the sedentary factor that comes in when you are injured. You're obviously lying down or sitting down most of the time, so you're not moving around as much, so you're more in that high category risk. So they give you stronger anticoags to stop you from clotting or risks of clotting, because risks of getting DVTs and things like that are just way too high. But yeah, thank God I didn't get a blood clot, because I was like, thank God I took those injections properly, otherwise waste of time.
Yeah, I mean, I've never had anything
major
like that before, but no. It's interesting that, like, the whole... It's interesting how you were able to get off of it. Like, you just got yourself off. Because a lot of people have issues with sticking with pain meds for a long time just because they need that kind of reassurance. Or
I just
especially
found
over in the US, get a lot of bad raps, a lot of...
addictive.
They get a lot of
opioids I was on opioids, but, I wasn't... My ones, you hear of friends and stuff that have, had big surgeries and they've, like, dozed out. Like, you just, like... How they react to the pain meds is just crazy. Whereas I was like, I didn't really ever really have that crazy. Everyone's like, oh, like, send me videos when you're on pain meds. And you go, there was nothing exciting about being on pain meds except for when I was on the cocktail straight after I got out of the op. But yeah, I didn't really want to, if my pain was under control, I just didn't feel the need to, the Panadol osteo was doing the job. And even my surgeon said that afterwards you shouldn't really get any pain because of I shouldn't say surgeon, the anaesthetist said that because you've had this spinal, I don't know how it works, but you've had this, pain shouldn't be as much of an issue. So yeah, straight from there, I just kind of back to gym. And
did you get bored?
Yes.
Like, yeah.
Yes.
Someone who's almost like, and as an athlete like yourself, you always want to use the competition as a keep, it's going to drive you to keep going. And if you're going, everything's so slow and it's 9 to 12 month rehab is something that's going to take a long time. And what did you use? How did you stimulate yourself to kind of keep going?
I mean, throughout that I had uni to do, so that was one thing that I had to sit down and do that. So that was the only reason why I sat down when I could. And then I tried to go to back to training. So at this stage, I was still at Sharks. So I would try and go to, and my little sister was playing at Sharks as well. So my stepdad would drive us there. I would do my rehab or more specific physio rehab at training and I found it was really hard to get away from a sport that you've been surrounded with since you were 12. Like, you've been highly involved in a sport for so long. I couldn't have sat home and just not gone to training. I just needed just to watch, just to be there, to be involved. And they were really good trying to involve me where you can. I mean, while I was on crutches, I wasn't really much for help. So I'd do my rehab, come out, just watch and chat. And you just need that social aspect as well, because that isolation when you're at home trying to heal is different to anything, than being sick and being away for, a week. Whereas I was like, this is going to be a long process in between. So I tried to go to training. So I went same kind of nights, Monday, or at Sharks it was Monday, Wednesday nights. And then I went to games as well because I was like, I can't be away for that long from a sport that you're just so highly involved in. And I, loved being around the girls and they were really good at trying to keep me busy.
Yeah. Was there like in terms of the club structure, was there like rehab sessions? Did you have like a training but off to the side doing your own rehab?
Yeah. Well, I just had my own. They just accepted that I just said I've got my own little rehab to do on the side, so that might take an hour, and training's usually 2 hours. So I'd go and do that on the side for an hour, and then just go out and sit out and watch and try and stay involved. But I ended up, because of COVID, being the COVID officer at East Fremantle Sharks, which is just making sure that girls weren't high-fiving and that they weren't going to the toilet in groups of like 7, because they just wanted to minimally stop the kind of high close contact kind of things.
You did wear the yellow vest, or was the high vis vest? Oh
yeah, I'll have to show you a picture. I was you couldn't have made me stand out more. I had crutches. And I was wearing a bright yellow vest. And I was like, the crutches not enough. So I ended up doing that for the season, which meant that I could still sit on our team's
watch out for the person on the crutches.
Yeah, exactly. That's what I felt was. So as soon as I could take that off,
don't do that around me. Yeah.
But yeah, I ended up. So that meant I could sit on the bench, because in netball you're only allowed 12 players or on the bench, and then 4 coaching staff or just support staff.
Yeah.
So by being that COVID officer, I could still be on the bench. Otherwise, when they brought players in, because I was still a contracted player up until then, I was still on the list, which meant that after that, when we had injuries, they had to bring other players in just to sit, just in case something happened.
Yep.
Just to make sure they still always had 12, which meant that I wouldn't be able to sit on the bench. So this meant that it was kind of a free opportunity for me to sit there and still offer advice and whatever, and still be watching the game and offer advice and little things that they could change. But yeah, then the netball season kind of passed, and I was getting more heavily involved in rehab as the season progressed, and then we finished, and then finished netball I think netball finishes in September, and then I just had my own rehab after that, just doing my own stuff.
When did you start running?
I started running only like 4 weeks ago when I was chatting to you. I was like, oh my God, I'm so excited to run, because it'd been, at that stage, you have to, it actually really makes sense, but at the time I was like, this is so stupid. My physio was like, you have to be able to jump before you can run. And I was like, what? But because running has got that no contact phase, you have to be able to bound to get off the floor. So I started jumping at about 6 months, just double leg jumping, bounding, broad jumping, that kind of thing, just getting some impacts. And it's really interesting, the research. You can only start doing a certain amount of impacts, and then each week you can progress. So it might be 50 contacts to start, 70, 100, whatever the progression is, and then single leg. And then I still can't really do, at the moment, I still can't do pivoting kind of stuff until I see him on...
Like change of direction?
Monday. Yeah. So I can do lateral change of direction, just no
180s. Yeah, okay.
So, yeah, I started running at 6 months, which was really, really weird. Everything was clicking and...
Yeah, right.
And all that kind of stuff. But I feel like for me, running was always a really good release, and I felt that I couldn't get that
anyway.
any other way. I couldn't get that going to the gym. I couldn't get that doing my rehab. And once I started running, I was like, this is actually really nice to just be able to run by yourself, do it on the side, stick your headphones in, just run. There's no...
Yeah, I don't know about that.
That's what I get anyways.
The people who say that, I'm just looking at them and go, I don't know, mate.
But I just feel so good after a running session, and I think that was really important. Once I started running, or just before I started running, I had a bit of a lull through rehab, and I'm sure anyone does. You get those moments where you go, this actually just sucks. Like I probably 100%. I had one bout of that like really early on. That was like 2 weeks after surgery, and I just hated sleeping. It was so uncomfortable when you just go, this actually just sucks. I hate lying down. I hate just not being able to do anything. And you can tell I just had black bags under my eyes because I couldn't sleep, because you can't lie on your side. You have to kind of sit up a little bit. I had like pain in my ribs because I was being like, you had to sit up a little bit, and it was just a little bit compression, bit of a compression force down there. But it would have been, just before I started running, I was just like, I hate this. I hate it. I hated going to training. I hated going to footy training, because I was like, the fact that they can just run is just really pisses me off. Like that's
such a competitive mindset.
Oh, I am so competitive. Yeah. Anything's a competition. Like, it doesn't matter what it is. And I think for me, starting from zero as well was really hard. I've always been quite fit and whatever, and I've always hated, like, you go to training, you go, she's running more than me, well, I need to run more than her, or fitness testing, whatever.
Reps,
I used to be like Juppy was saying on the podcast, I get so anxious for fitness testing. You just go, there was always a lot of pressure on me going, what happens if I'm not the fittest? Like, what's going to happen? Like, I can't not be the fittest. So you run and you're doing the fitness test. You go, how is she? Like, oh, we look all right. We're about the same. We both look pretty tired. But yeah, it was just, I hated sitting, doing nothing, like not doing nothing, but I was so close, but I'm still so far. And I just got myself in a bit of a rut, just trying to, go to training. And, it just, I think my biggest thing was just trusting the process. And my physio said that it would have been, he kind of noticed that when I was doing Pilates, he goes, you look a bit flat, mate. And I've gone, I am. Like, I'm hating rehab. And he was like, is it boring? And I was like, no, just the mental side. And that was probably the only time. And I think I just kind of got myself stuck down there, because I hadn't felt like this the whole time. Because you go, I'm so excited to run. And now that you're there, you go, oh, I've still got to be able to get my fitness up first. Then I still have to change direction. I still have to kind of reintegrate into training. And only then I can start returning. So it was, that mental side was such a big thing for me to overcome, just because I hadn't really gone through a rut and felt that way. And I remember talking to my coach about it. I went for a walk with her before training started, and I was like, there's so much that I still need to do. And I just, I feel I'm with all the girls, but I still feel so isolated. Like, I'm still doing my own thing. I'm not in the training group. I'm with the training group, but I'm not in the, feel like I'm not in
the team yet. And
she was like, you know what, you've done all the right things. And she goes, if anything, you're more committed here than, what they are. You're coming, she goes, it's so easy for you to go, you know what, I'm not really feeling coming to training tonight. You're not. Yeah. And she goes, it's easy for you because you're not training, so you could do that. But she goes, the fact that you're here is half the battle.
The process of showing up's the hardest one.
Yeah, definitely. And each week just going to, like, and now that my running sessions are a bit longer, I don't have to, like, sit there and watch the training. And now that, and even then, I can be a passer now, which is like, you go. I think that was the hardest thing, being involved but not involved enough to still be part of it.
Yeah.
So yeah, when I had a chat to her, it just put everything back into perspective. You go, I'm so close, and I think the thing that I'm so close, but I'm still so far away. So, and she was like, just ride. What she said to me was really important. Just ride the wave. She goes, when you're feeling down, feel it. Just feel it.
Yeah.
And
Don't
then
block
when
it
you
out.
start feeling good, it'll like just ride it. Just be there, experience the emotions, experience what you're feeling. Because if you start to push it aside, then you're just going to bottle up again, and it's just not gonna. It's going to be this self-perpetuating cycle where you're not going to feel better. You're just going to feel like shit the whole time. She goes, you're quite a positive person, so you'll get through it. And I'm quite a motivated and determined person anyways, and pretty self-driven. So it was just a matter of just feeling how I was feeling and, this sucks. I hate this. Just feel it. And then now, like 2 weeks later after that, I was like, back to normal.
It's funny how the brain plays games with you a little bit. Just kind of test you, a little bit of testing. How's this? Hey, how's you going to cope? Or how's this person going to cope, with this kind of state that you're in? And just kind of keep... Obviously, you'll play tricks on yourself almost to kind of, once you don't want to go for the run, or you don't want to go to training, just put one shoe on.
Yeah.
Once you put the other shoe on, and you're kind of like, I've got the shoes on now, so I might as well just get up and go.
I think that helped me having that structure of training going, what, I really don't want to run today, and I am really having a shit day, but put my shoes on, go to training, you see everyone else running, you go, okay, great. No, I'm competitive. I go, okay, if I run, then I'll be fit enough. I'll be fitter than I was just before that to then join in.
Structure's amazing, isn't it? Like how much you can kind of get back into a routine and how just it kind of affects the way you feel almost.
Definitely. I think through rehab it's really important to have a routine or just go, I'm going to do rehab Tuesday, Thursday, Saturday or Monday. In my case it was Monday, Wednesday, Friday.
Yeah.
And then maybe I had to start doing hydro. I had to swim in between the time that I wasn't running just to get some kind of cardio because I was like, I'm not going from zero to running.
How'd you find swimming?
I hate swimming. I hate it. Absolutely hate it. I'm not a water animal. I can swim, but
it's harder.
I don't like the fact that you can't breathe all the time. So when you're really out of breath, you can't just swim and swim with your head on the side. I was just like an idiot, and I don't know what I look like when I swim, but I feel like I don't look great. So that's half the battle.
Shit.
I always think when you're swimming and you finish a set, you go, I wonder what I look like doing that. Probably not great, but we'll just keep swimming anyway. Put the goggles on, they won't know who I am. But yeah, getting through rehab is tough, and I feel like you put on a brave face the whole time. Like you come to training, I feel like I probably came to footy going, oh my God, I'm fine. And on the inside, you're like, oh, I hate this. Hate it. But, I think that's probably the worst thing to have is that, yes, you can put on a brave face the whole time, but you've also got to be, I think that was the trick with me being netball girls. I just had to show them that I was vulnerable and go, you know what, I'm really not doing well. And, they were pretty good at picking up where you're at and going, okay, we need to give her a bit more love here. We need to support her a bit more. We need to cheer her on a bit when she's doing a rehab. But yeah, it was just kind of getting through that.
It's good for the team as well to kind of see other players like be vulnerable, especially during rehab. Kind of brings the group a bit closer together because I guess women are good like that as well with being together and supporting each other. They're naturally very good at pulling people together and then supporting them through tough periods. It'd be much better for a team for that in the future, you sharing the feelings like that, and then you get closer together, especially for a young team. Like
it's definitely an important thing to be able to have both sides, and especially in a team sport, you can't just have the fun times and the good times the whole time. You need to, especially most people, and especially being a new team, we kind of had to click through that straight away. Just go, we need to be able to show both sides because I knew four or five of the girls in that team really well, but the other four. I had, I'd never met before or I'd played against them. So you just have to kind of drop your walls and lose it all and just go, especially for me, I think me being able to show that two sides, then everyone, went, she can do it, so can I. Like, and people come in and it's really good now. People come in and go, you know what, I've had a really shit day at work. And we acknowledge it and we go, we're all here for you, have a bit of a chat. And then when we go out in court, you can understand if they've thrown two balls away and the coach has said something to them and they just take it. They take it really badly, and usually they can take it pretty well. You just go, give them a little tap and go, it's all good. Just start again. Next ball, don't worry about it. So I think it's just really important, especially I think girls are quite good at recognising those emotional changes and whatever, and especially I think netball as well. It's funny, I can just tell when girls walk into training and they just not there. You go, everything okay? Like, you just check in, and it doesn't have to be like, oh my God, is everything, you just go, all good. Just look at them and go, you don't want to make a big deal about it because then obviously if someone's really sensitive and not feeling like they want to share, then they might just explode. So there's ways to just approach it and go, everything okay? And they might go, no. And you go, if they don't want to say anything, go, we're here for you. So you just need to, I think sometimes you just need to have someone there just pat you on the back and go, we got you. Like, that's all you need, I think, at training. If you don't feel comfortable enough to share, then just just be there. I think
I guess it's the kind of hardest thing as well, being because you live a life outside of the sport as well. Like you have a professional life, whether it be study, work, or anything like that. But then be able to separate that, and then within an hour of like driving to the training, getting changed, and doing all that sort of stuff. And then now I'm netball training, and just hard to drop everything. You've just the stress of life, and then have to do everything that a coach expects. You have all these expectations from training, and be able to execute skills and all this sort of stuff while having a stressful day makes it hard, and kind of everything just gets bottled up. And
definitely
some days it's going to be harder, some days it's not. But then it's kind of hard to separate that, isn't it?
Well, we had a leadership. I say conference. It wasn't really a conference. It was just like a leadership session with Darren Harris, who was actually the Claremont head coach. So he takes on a bit of a leadership thing. He has his own, I don't know if it's a company or whatever it is. He's done quite a bit with footy clubs and kind of business side of leadership as well. So he came and chatted to us, which was really good because there we were able to establish our standards and things like that. And we said, along with that you know what, we have to acknowledge that people are going to have bad days and at work, and they're going to bring it in, and it's just going to bring the group down. And we said, one of the things that we said we weren't going to accept is people bringing stuff in and bringing the group down. So if you bring it in and let someone know, but don't keep dragging it on and going, keep bringing it, leave it at the door or communicate it. Or we said not come to training. If it's affecting you that much, we don't want you to feel like you need to try and bottle it up while you're at training. And we want the best out of each other. So we said we don't think in that situation that we'll be able to get the fullest out of you, and you won't be able to get the fullest out of us. So we said we had three options. It was either leave it at the door, communicate it, or just go, you know what, girls, I really can't come to training tonight. I'm having a bit of a rough time at home, rough time at family, whatever it is, work. And we said that those are the three things that we would accept, which is, important to establish as a group. Otherwise,
exactly.
Too many things going. Someone comes in and each week they've got a really stressful job, and each week they keep coming in going, oh my God, I've had the worst day at work. And you go, you said that last week and the week before that and the week before that. And we said we just weren't going to accept that because at the end of the day, we've only got 4 hours of training a week, and we want to make the most of those 4 hours, and you can't be away with the fairies with something else and not being occupied.
Yeah, I guess that's a big paradigm shift from, I would say, maybe 5-10 years ago, where it was you're at training, your expectation is come to every training, we don't play, all this sort of stuff. But now it's that, because life just gets continuously harder and more stressful. Like it'll be 10 years' time, it will be even harder for life. And then it's got to be able to have an understanding as a team and have the expectation, or have it outlined early in the start of the season, like this is the standards, this is what we're gonna accept and not accept, and it's okay to obviously stuff gets in the way, and
definitely
be able to have an understanding of what's going to happen, and take the time off if you need time off. We'll be here will you come back, I guess.
I think at that level you need to be able to either communicate it or just be able to. I think it becomes really hard to challenge it, but at the same time you need to. I think at that level we were all it was pretty easy for us to come up with ways to come around that problem. It was kind of, there's three options there. It just seemed, and we all accepted it, and we all talked about it, and we were like, great, at least everyone's on the same page. But I think coming into like a waffle one-all level, sometimes it's a bit hard to, we've all been in state teams where you go, that's just kind of expected, and you go, it was kind of, when we were talking about it, you go, it's a non-negotiable, like it's just that's the way that we deal with it, and that's the way that it just seemed so silly, not silly to be talking about, but we were like, we know what to do, but it's making sure that everyone knows what to do, and there's not one person that's feeling different about something, and being able to chat about it, I think, was the most important thing, just to establish, and especially any standards at all. He must have split us into 3 groups, and we talked about challenging, what we were going to challenge, so things we weren't going to accept, what we wanted to model, and what was the other one? Model, challenge, and there was something else. So that he split us into 3 groups, and we had to chat about that. It must have been, what was it? Now I can't remember. It was really good to listen to what people thought was really what we needed to model as a group. What we needed to. What were we going to do? What do we want to look like to other people? How's that going to translate? And we chatted about it, and obviously cut that down to, the girls, we brainstormed in the groups, and then took 5 things away from each group, and went, you know what, these are the 5 most spoken about points. this is what we need. These are forming our standards. This is what we're going to do. So it's really important, and even challenging, being on time, punctuality, all that kind of thing, challenging negativity. You know what, we're going to stamp that out. There's no need to be so negative. There's no need to try and, provide some feedback, but go about it in the wrong way, that kind of thing. So it was really important, and I found it was really interesting to listen to everyone's take on what they accepted, what they didn't accept, and what they wanted to model, and then that kind of grew our standards from there, which was really important.
So you have a team values type of standards?
We have 3 words. So it was last week we finalised it, because we were like, we had such a big group of things that we wanted, and you want to encompass everything, but at the same time it needs to be simple. Everyone needs to be on it, and Darren said that it can't be it can't be just words on a wall. It needs to be, we need to live it. So
exactly,
it's fierce, family, and friends. So obviously,
nice.
Fierce, family, and flags.
Yeah.
So we had family
Flags.
The same. So flags as in, it's pretty similar to, we must have been watching Making the Mark. We watched an episode. She told us to go away and watch this episode. Our head coach, and we watched it. It was about West Coast Eagles and their values, and ours just seemed really similar. And Carly went, you know what? Let's it's going to be similar, but that's okay. We still so our flags, obviously you want to win. Family, friends, making sure that you have that. We have that tight-knit group, and then fierce was on the netball court, just being relentless, making sure you're doing the 1%ers, not leaving, we don't go down without a fight, that kind of thing. So just making sure that all of our behaviours were encompassed into those. So there are 3 Fs that is our, you can call people, you can call people out on them, and obviously we know we know our standards. So, we can pull someone up at training going, is that 100%? I don't know, just it might not look like it, but if you have no excuses as to why you're not, then...
That's a good, especially coming from a coach, having team standards and values, and that is easy to kind of, not judge, but kind of set or rank where you are, where you're at, in terms of is this, relentless, or is this being family, is this the flag, is this going to get us to the flag, and that's just we can kind of, challenge those type of areas and push the playing group in a way that's going to hit those values, because at the end of the day they're the ones who came up with those. So if you're going to come up with that, and you're not going to live it, we're not going to
definitely
train towards and that sort of stuff.
And even as Juppy was saying that, listening to that last podcast, it's the hardest thing is being able to pull people up on being able to, we're all friends, but you need to step away and go, I want the best for the group, and being able to pull people up and go, you know what, they might not like me doing this, but I'm not here to be liked. We're here to have a job. We all got that flags. That's our last value. We want to win a flag, and being able to, lose your pride for a second, pull people up, because at the end of the day, you go, like you said, you want to be, I don't need to be liked, I just want to be respected.
Yeah.
And that's what, you need to, that's the hardest thing. Being able to pull people up is being able to pull people up.
You find that challenging being such a young group? And you've got so many young girls.
And playing together, we've all played, there's a group of 5 of us that have played state teams together and whatever, so we're really close, and you go, it should be easy for us to do it. But I think in the last couple of years, I found it easier to be able to now pull people up. I think
it's a maturity thing as well.
You don't feel as, violating.
Yeah.
Saying it.
Yeah, I understand.
It's coming out of the right place, but I need to tell you, because we're not going to win with what we're doing.
Exactly. Well, you're there for essentially one. Well, you would hope you're there for one reason, to win a flag and all that. But if you want to challenge and because it's even if you would have seen The Last Dance, how invasive Michael Jordan was, and how much he kind of he pushed everyone so hard that he stepped on a few eggs. Yeah, he broke a few people doing so, but they were the most successful team of that era. Mm-hmm. Because he was able to challenge everyone, and at the end of the day, they all respected him, because he was almost essentially a living legend at that stage, and they were like, "Oh, we got really no choice if we want to win."
I'm definitely not Michael Jordan. I definitely don't pull people up like that. There's a nicer way to do it, but
but I think because there's daylight between that kind of competition and where you guys are as well. It's not like they lived at such a high end of the spectrum in terms of
definitely.
How much they lived in the spotlight and how skilled this whole team was. And the egos that were around that as well, that he really had to try to keep everyone
on the same
in line. And even the program 11 Rings by Phil Jackson, his coach. That's even more interesting, because then he had to go. He went and coached LA Lakers with Brian and Shaq, and all that. Those guys never got along, and how he had to
You
kind
have
of
to bring them all together and go,
Yeah,
we're here
yeah,
for,
yeah.
we want to win that premiership at the end. It's, we just need to, you need to lose your ego for a second, play like a team. Otherwise, it's the hardest thing as well, being able to play as a, you have a team of stars, making that star team. I know that's a pretty cliche kind of thing, but it's so important. You might have so much talent, but you can't play together. That's
exactly.
That's half the
And even like I think as well, egos as well is one. You don't want to try to disarm someone's ego. You want the ego to kind of fit around the team.
You want to flourish it.
Yeah, yeah. You want you don't want to squash other people, because it's essentially what egos make people great. Like, Michael Jordan had the biggest ego going around, but he was like the greatest player ever. Like in Phil Jackson, you were saying like he was easy to kind of pander to his ego, like just kind of talk about like
just pump it up.
you being so great is making the team better, like all that sort of stuff. He's trying to relate as a coach's challenge, just trying to make everyone's ego kind of fit together and try to help the team be better.
I think even with that, you see that watching the footy boys, you need to pump people's egos up. Otherwise, you lose
them. Yeah,
and girls, you're not so much everyone. You kind of play to each other's strengths. You're not so much like, you don't know someone. We're not as loud, and I mean, there's a certain group of us that are vocal, but you don't need to. Some people you need to rough up in the warm up to get them going, but you don't need to. There's not too many egos in our team. I don't think that need to be kind of pumped up and spoken about, and just go, you know what, you are the best, and they go, yeah, I am. I mean, it would be a great thing to have, but also everyone just seems to play off each other, and you know how people are feeling, and you go, she's having a good day. She seems like she's having a good warm up. Let's go. Like she's going to be on.
It's crazy. I think you can almost sense it, can't you? Like how everyone's feeling. You get a sense of the room. You kind of walk in, you get the vibe. If some days they're flat, some days you're not.
Yeah. Like I love the thing. It would have been the first. What would have been one of the first preseason games, and Marshy's was in they were doing their ball warm up just before they went on the field, and he was picking out people that were having a good warm up, or they've got new shoes on, and it's really I really wanted to you want to take that away, but in netball it seemed kind of silly if I started saying that kind of stuff. But I think just even in our group, you just need to go, you know what, you look like you're having a good warm up, let's go, like you're looking good, pump people up, and I think that'll probably hopefully help performance in the end, but not as his was quite funny at the same time, but it's...
His character.
He is. Love it. I just love how dedicated and just, he's doing everything for the team, and it's just loud and proud, and, has no problem telling people how it is. Wish I had that.
You hate that?
I wish I had that.
Oh, you wish you had that.
Because, to tell people how it is, like we were saying before, you don't want to make people, you don't want to belittle people and go, oh, yeah, shit, you're doing this wrong, you're doing all this stuff, but at the same time, he's doing it for the better of the team, and is, and I think people, people's character at the end of the day, and going, he's not doing that to, piss me off, he's doing it because he wants the team to perform at the end of the day, so.
I used to have, my biggest challenge with that when I was younger, I had the first kind of, I used to work with a lot of the under-18s at North Adelaide and the under-16s, but then when I moved up and worked with the senior group at North Adelaide, five of the guys I was in the same year at in high school. One of them was like a college captain, another one went and played AFL, came back, and then a couple of others were the under-18s from a couple of years ago that were like ended up being like promoted up into the senior group. And the biggest challenge was like kind of I already knew these guys, but then the kind of the status quo kind of changed in terms of the standards of the team and how we wanted to kind of run our program in terms of like the conditioning and the strength standards, and just trying to make everyone, trying to tighten it up a little, make it a little bit, not so much harder, but trying to make it more professional, if that makes sense.
Yeah.
And then the hardest one was like just going at the guys that I went to school with, because they were like trying to play, like not to play jokes, but trying to like, muck around with me a little bit, trying to like feel back in high school or whatever. But it's just like, all right, lay down the law early. Was kind of the one you just have to let them know early.
Yeah, you can't like...
Stand in front of the team, just go bang, bang, bang. That's it. And then they'll kind of go, what? Oh. Yeah, the whole group kind of goes, all right, this is how it is now. And then I'm like, you don't lose a lot doing that, but then some people challenge that. And then the easiest way, I just found you during like a gym session or during their warm up, you just kind of go individually, kind of go up to some guys, just go, how you feeling? And just go kind of check in with some guys you probably know who are a little bit of the quieter ones who don't really take well to someone being so direct.
Yeah.
And then, you just trying to go back to those guys and just kind of pat them on the shoulders, be like, oh, everything's all right. And then they kind of get a different sense of who you are. And it's like, okay, well, he's not this guy. He's just going to run around and blow the whistle and point fingers. And And then you kind of set the standard early. And then every now and again, you might have a might do something that changes it up. He might, the warm up isn't so structured today. We might play a game, and everyone's like, joking around.
Not fun.
Yeah, like good change up, blah blah. And then it's all right.
I think for us, we've said like the follow up is so important. Like you can blow orders at people, but as you said, there's people take things really differently, and go, oh, why? Like he must hate us or something. And you go, you know what? It's okay. Like, how are you going? Like,
yeah.
Yes, everyone's got so many sides to them, and I think it's important, like we said, to show all sides, be vulnerable, be hard on people, be that personable, accountable person at the same time, but also being able to go, how you going? Like follow up, and you might say something, or you might say in the warm, you might yell something and whatever, and go, oh, I didn't mean it like that, but make sure going, sorry guys, didn't mean to yell it like that, but it's all good.
I think that was one of my biggest mistakes as well, going in from taking the mind, or not the mindset, but kind of my coaching, how I coach men and how I coach women was like the first kind of warm up I ran with the women. I was very almost too direct and too
authoritative.
Yeah, almost too. But at the same time, it wasn't. They ever had experienced something like that before, so it was a bit of a culture shock for them. And I think I lost a lot more doing that. But then, turning around and then going to the gym, you could tell I lost a few because some of them wouldn't. I could tell like the way they would interact with
some
it. They would
just respond.
Yeah, but they weren't responding to the way I initially thought they would, and so biggest one with women as well. They challenged me back. Some of the guys are just like, okay, they accept it. There's some of the guys that push back a little bit and I'm like, oh, okay.
Okay, I need to pull back.
I was like, okay, this is the reaction I'm gonna get.
No,
maybe I might change, and then but then once you get to know someone, especially in the rehab setting, is a lot more gentle with someone.
You just have to, at any time. Like especially that time where I had that really rough spot, I reckon if someone yelled at me or did anything, I reckon I would have just cried, like just broke, just like snapped. You just feel so sensitive. You're just like, if someone had yelled at me or someone had done something. I remember one point I was a passer and I knew that I did a shit ball, and then my coach said it and I was like trying so hard. I was like, not even just don't cry, but I was like, don't get frustrated, like it's fine.
It's
just like, I knew straight away.
Like the internal monologue you have to have with yourself.
Yeah, and that's half the battle, just going, I can do it. Like, it's okay, and I kind of had to remind myself, you haven't thrown a ball in a really long time. Like, you haven't done a drill like this in a really long time, but you just, at the same time, you go, I should be back where I am, but, you still need to do the hard work to go back to where you are. But, yeah, I mean, it's, you have to, it's a battle internally as much as it is with everyone else.
Exactly. You always be back when you do come back, you almost be a better version of yourself.
I think so. I hope so. And even I think having rehab at the end of the day, I got a different appreciation for the game. You listen to what coaches, to what the coaches say, and you go, that's what you mean. Like when you're in the game, you just go, I'm trying, I'm doing my best. Like, and you just listen to what they're saying, and you watch people, how they, either take that on or they don't take it on, and, what happens, what are the ramifications for them not taking on feedback or not implementing it straight away. So now I can see two sides and asking questions if you really don't understand.
Have you heard of the chimp paradox before?
No, I haven't.
So they talk about your brain is like you have such an animalistic process for your brain that just everything feeds off emotion, right? Yep. So like when you're in the heat of the moment, like you're saying, like in terms of like in the game, everyone's so emotional, but the coach says something and they don't process it because your brain's so full of emotion, just processing the emotion of how like your performance, this sort of stuff. And then like you were saying, and then you were able to realise now that when you're not playing and you can have more appreciation of the game because you're not in that emotional state where you can balance between what they're saying and you can process it in your brain. Yeah. So that's a chimp paradox. You just have full of emotion and then be able to separate it between like an animal and human brain.
Yeah. I think it's really interesting even to watch. Like we can watch review and go, oh, you can see the game from there, but actually sitting back on the sideline and watching it, you're like watching the game pan out, whatever. You can watch from the sideline and be off for a quarter, but you're too far analysing on the player that you are potentially going on the next quarter. What are they good at? What are they not good at doing? Trying to, think about how to play on them versus actually watching. And
it's almost like being in the flow state as well. We did a lot of, Jenny Williams came in on board at North Adelaide in 2018 when we won the premiership. And because we had a very young group, and she kind of helped the guys get into like the flow state, which was like being in balance between emotional but not being like bummed out and this sort of stuff. And then she talked a lot about it, and then she didn't do it wasn't like a lot of meditating. It was a lot of like just teaching the guys this like communication type of stuff, how to react with guys, and just kind of teaching them because she's if you don't know Jenny Williams, she Mark Williams' sister from
okay.
the coach.
Yes, I know who you're talking
but
about.
yeah, so she's I think she's the youngest out of four
yeah.
brothers or three brothers. But like that family is like rich in history in Port Adelaide Football Club in Adelaide now. I think Mark's working in Victoria. Some AFL club he's working. We used to work for Richmond.
Yeah.
Did a lot of work there, and yeah, Jenny's done a psychology degree. So she does a lot of work with the guys, and she was great with the guys. Like, it's just hilarious. Like after on game day, she'll be after we run a warm up, she'll be in there, and she'll have like she'll just have like red frogs and just be like, good warm up, like just giving like little treats and this sort of stuff. And everyone loved it, and she's hilarious.
Listening and watching, some psychologists. I remember the fever psychologist coming in and telling us that she was with the Cairns Taipans, that she would come in, she would kind of just watch and assess the situations and go to the coach. This person is really not taking on what you're saying. You need to change what you're doing because you're not getting through to them at the end of the day. So being able to assess situations and whatever must be really difficult. But
I think it says a lot about a coach as well who can actually take on board or put their like ego aside almost and then being able to realise, okay, this is like a different tact. I have to go about this a bit differently to this person.
This person isn't responding.
Because especially a lot of coaches who have come through the system and they would have been coached by guys who wouldn't have given a shit about them. At the end of the day, really, they just wanted to have their own their coach's ego was taken over.
And they were just too focused on winning and going, you know what, doesn't matter. Everyone needs to be, I don't understand why nobody's on the same page. We've talked about it, but yeah, response from players is half the battle.
I loved that Making the Mark documentary. I really loved, it's no wonder why they're so successful. It was Richmond, Damien Hardwick. And mate, they had the one simple clear message, like, was to play our way. And like you said, after every huddle and everything like that, just do we think we know what we have to do? Let's just do it.
That's the last phrase.
Everything we said.
Go out.
It was the consistent message. And the same thing, we said that same thing at North Adelaide, was that same consistent message was always at the start of every pre-game meeting. And I would drum it in like at our, in the warm-up, I'll just say the same thing. Play. Well, I think I can't remember what it was. It was that we are one and pressure and first give was our pressure and first give. I was like pressure, first give, and we were doing our like bumps and tackles, like pressure.
Once you say it, like if you say it at the end of every, you live it exactly. I mean, that's like that Mamba mentality. The Kobe Bryant. Just you need to say it that many times and
live it.
Be able to do it that many times that when you say it, that just switches people on to go back on. But yeah, I mean, it's been interesting watching from afar, and hopefully end of mid-May I should make my comeback. So
mid-May. What are the next kind of steps in the rehab you've got?
So I see my surgeon on Monday, which is exciting. I'm like a bit nervous, but also because you just go like, I'll actually be able to start hopefully integrating into training. So that'll be 9 months. So I'm kind of on the cusp of like the earliest rehab time, but I've been like, I've had no problem. So there's no, like my physio's like, there shouldn't be, I don't see why there could be a problem for you not to start. So hopefully Monday that night, hopefully I should start back into, I might be only able to do the first 10 minutes of training, but from there, and then once I've started doing a bit more training and I'm a bit fitter, then it's just getting back into games,
skills
and whatever. And I mean, from the start, training will be, I think games will be, I might be only like on time restrictions. But yeah, hopefully soon.
That's exciting.
Exciting times ahead.
It'd be good because we'll have continue chatting at trainings and that sort of stuff. So you're going.
We've got a live, so I can show you we've got like a called Centre Pass or something, which is our live stream for netball on a Friday night. So once I start playing, I can
push that out
that and show people, go, oh, I'm back, which is, it's weird saying I'm coming back because I feel like I've never left, but at the same time I've been away for so long.
It isn't it. Rehab is like an interesting, like it plays, what we said, it plays on your brain and it just tricks you a little bit because you are away, but you're not really.
I'm there, but not really. Not physically on the court just yet, but soon, coming soon, that's what I like to say. Coming soon.
Well, wish all you and all your young team all the best this season. Hopefully when you come back, you're tip-top shape and we can put you out there and be awesome.
Get back out there.
I hope everything else goes smoothly from now on. Yes. And I appreciate you coming to share your story.
Thanks for having me.
Hope we might have to do a part 2. I say this to everyone. We're doing a part 2, but when you come back after the season, we'll do
maybe in like a year when I've had a full year back at
full playing. Year and back and see everybody's adapted and responded. Yeah. And you can teach you some tips on how to run and like running.
How to like running, yeah. I've got a whole year to think about that, so I'll come up with some succinct tips for you.
All right. Thanks, mate. I appreciate it. Cheers.